Ramesh lived in a small village. It was called Sonapur. He was a farmer. He worked hard on his land. He had a young daughter, Priya. She was his world. Priya loved to run in the fields. Her laughter echoed. But one day Priya fell ill. A high fever gripped her. Ramesh was worried, very worried. The village had no doctor. The nearest clinic was miles away. The sun was setting fast. There was no proper road, only a muddy track. He lifted Priya in his arms. He started walking. His heart pounded with fear. Hope was a tiny flickering light. After hours they reached the clinic. It was a small, dim building. A healthcare worker was there, not a doctor. They had few medicines. Priya needed more. She needed a hospital. The worker looked helpless. "Take her to the city," he said. The city was too far, too costly. Ramesh felt despair. His little Priya was fading. He held her close. He prayed for a miracle, but miracles are rare in such places. Priya's breath grew faint. She closed her eyes. She did not open them again. Ramesh lost his daughter, a life unlived, a promise unkept. Our cities shine bright. They have big, modern hospitals. Doctors with many degrees work there. New machines save lives. People talk about medical tourism. India is proud of this progress. These city hospitals get high ranks. They are seen as the best. They attract money and talent. This is one side of India, but there is another India, the India of villages like Sonapur, where Ramesh lives. Here, healthcare rankings mean little. These rankings often forget rural needs. They focus on specialized treatments, not on basic, everyday healthcare, not on the health of a child like Priya. The system measures what it values, and rural health is often not valued enough. This focus on urban excellence has a cost. It deepens the neglect of rural areas. Resources flow to the already strong. Doctors want to be in cities. Nurses prefer urban postings. The best equipment stays in cities. Rural clinics remain underfunded. They remain understaffed. A shadow is cast over village health. The gap between city and village grows wider. This is not just a gap, it is an injustice. Health is a right for all, not just for those in cities, not just for those who can pay. When rankings only praise the urban, they hide the truth of rural suffering. They make us forget the Rameshes. They make us forget the Priyas. We must see both Indias. Why does rural healthcare struggle? The problems are deep. Many layers exist. First, look at infrastructure. Many villages have no clinic building. If there is a building, it is often old. It lacks water. It lacks electricity. Roads to these clinics are often bad. Ambulances cannot reach easily. This is the physical barrier, a broken foundation for health. Then there is the workforce crisis. Doctors are few in rural India. Nurses and technicians are also scarce. Many do not want to work in villages. They face poor living conditions. Their children lack good schools. They feel isolated, unsupported. Salaries may not be enough. The system fails to attract them. It fails to keep them there. Money is another huge wall. Many villagers are poor. They cannot afford expensive treatments. They cannot afford travel to city hospitals. Government health schemes try to help, but often they do not reach everyone. Sometimes people do not know about them. Sometimes the process is too complex. Out-of-pocket expenses crush families. Health emergencies push them into debt. Culture and awareness also matter. Some old beliefs can delay treatment. People may not understand symptoms. They may not know when to seek help. There is often a lack of health education. Sometimes there is fear or mistrust. Fear of formal healthcare systems. The system must understand local culture. It must build trust. These cracks in the system cost lives. Section 4. Designing dignity, fresh solutions for India's heartlands. We cannot use old maps for new roads. We need fresh ideas for rural health. Design thinking can show us the way. It starts with understanding people, understanding their needs, their lives. It focuses on solutions that work, solutions that are simple, solutions that are affordable, solutions that bring dignity. This is how we can build hope. Imagine mobile micro-pharmacies, small vans like clinics on wheels. These vans travel to remote villages. They bring essential medicines. They offer basic health checkups. A trained health worker is on board. They visit regularly on a fixed schedule. People know when help will arrive. This makes healthcare accessible. It brings it to their doorstep. Think about decentralized drug warehouses, not just big storage in cities, but smaller units closer to villages. These can be in block-level towns. They ensure medicines are always available. No more shortages at local clinics, no more long waits for supplies. Technology can help manage this. Simple inventory systems, quick delivery to where it's needed. These are not just dreams, they are practical steps. We can train local youth as health aides, equip them with basic skills, use simple technology like smartphones for diagnosis, for patient records, empower communities to manage their health, involve village councils, make health a shared responsibility. Solutions designed for people by people. Section 5. Building bridges, the power of tech, policy and learning. To fix rural healthcare, many hands must join. Technology can be a powerful friend. It can connect the disconnected. Telemedicine is one such tool. Village patients can consult city doctors through video calls, through apps. This saves travel time and money. Simple mobile apps can give health information in local languages, easy to understand. Technology can make healthcare smarter. Policy must be the strong backbone. We need firm government commitment. More money for rural healthcare, not just promises, but real budgets. Policies that encourage doctors to serve. Better salaries, better housing in villages, clear career paths for rural health workers. We need accountability in the system. Ensure that funds are used well. Ensure that services reach the people. Education is the light that guides. Health education for all villages. Teaching them about hygiene, nutrition, about recognizing early signs of illness. Empowering them to demand good health services. Training more community health workers. Giving them the right skills, the right knowledge. Updating medical education to include rural health realities, to inspire young doctors to serve. These three pillars are vital. Technology, policy, and education. They must stand together. They must support each other. One pillar alone cannot hold the weight. It needs a combined, coordinated effort. From government, from health professionals, from NGOs, from citizens. This is how we build strong bridges, bridges to a healthier rural India. Section 6. A nation's health, a nation's conscience, our urgent call. Friends, the truth is before us. The stories of Ramesh and Priya are real. They happen every day in our country. We cannot afford to look away. This is not just about statistics. It is about human lives. It is about basic human dignity. A nation's progress is hollow if its people cannot get basic health care. The last mile is the hardest. But we must walk it. To our policymakers, I say this. Your decisions shape millions of lives. Listen to the silent cries from our villages. See the ground reality for yourselves. Make bold choices. Invest in rural health. It is an investment in our nation's future. A healthy population builds a strong country. Let your policies reflect compassion. Let them reflect justice. The time for small steps is over. To our educators, our teachers, you shape the minds of tomorrow. Teach our children empathy. Inspire them to serve humanity. Create a new generation of health warriors. Warriors who will go to the villages. Warriors who will fight for health equity. Nurture the spirit of service. Show them that true success lies in lifting others up. And to every citizen of India, this is our fight too. Raise your voice, ask questions, demand better healthcare for all. Support organizations working on the ground. Volunteer your time, your skills. Do not remain a silent spectator. Every life in every village matters. No child should die like Priya. No father should suffer like Ramesh. Let us build an India where health is a right, not a privilege, for everyone. Jai Hind.